Are you facing the same kinds of workplace pressures that we've been hearing a lot about at this set of meetings?
I think, yes, in a lot of ways, we're facing situations in which we are running into excessive overtime shifts. We're being asked regularly to work beyond our general pardon me, we're being asked to work beyond the hours we would expect to work. I know I'm a full-time employee and I could work way beyond full-time hours, and I don't think that is very helpful to myself, even though there's financial gain there, but the burnout factor is very high. Well, I mean, a long-term relationship with the patient, you establish that rapport, that trust. It takes more than a short period of time or brief interactions to develop a therapeutic relationship with someone with a persistent mental illness. Full-time staff, I think, are a huge benefit and very necessary to having the system run smoothly in mental health. Well, one of the things that I find is a huge challenge, especially for the newer people coming in. You come in with an attitude that you want to help, you want to sort of save the world, help these patients, yet in the institutional setting or even like the hospital settings are very busy, very saturated, and there doesn't seem to be the availability of community supports outside of the hospital structure.
Expand on that.
I'm just finding that a lot of our patients that come into the system are, we do our hardest to treat their symptoms and to identify their illness and work with them very intensively while they're in hospital. But once they leave hospital, there often isn't the availability of supports, and then I find that the same patients continue to come in the whole revolving door syndrome, and that creates, I think, a lot of burnout for the newer people. You feel like, okay, I've done all this work, and once they leave the facility 3 weeks later, or maybe 3 days later, could be 3 hours later, they end up returning, and you're starting off from square one very often again with the same patients. And the repetitiveness and redundancy of that, and I guess the lack of integrity, pardon me, not lack of integrity, but the amount of integrity that a person expends to help a patient seems demeaned when they just fall into the same trap they were in before after leaving hospital.
Working in your field can be physically demanding / dangerous at times.
Yes.
Are there issues around that you think the union has a role in making you safer in your workplace?
Actually, I've been very fortunate to be part of a union that has significantly aided in the safety of my own personal well-being on the unit in more than a few situations. Recently, through filing PRCs, we've gained results we had doors that were high security room doors that were not operational, and have a violent patient in the back, somebody that needs their behavior to be controlled at that time, and we had situations where our doors were not working adequately, and situations like that through the union were resolved very quickly, even though there was huge financial undertaking on the employer's behalf and a very slow process and reluctancy to act quickly. The pressure from a large collective group of people really significantly impacted the speed in which our situation was resolved, and there's no question the unit has improved safety for staff and clients as well because of the ability to put some pressure on employers in dangerous situations.
Are there other things you wanted to talk about that I haven't known enough to ask you?
Well, I guess one of the things that I thought was when I was thinking about what it means to be a union member to me is it seems to me that we're more than just healthcare. We're more than just a bunch of nurses taking care of patients. It's like we have an opportunity to be political watchdogs. We have the ability to network and share information between other unions and other collectives of people, and it just raises an overall social conscience that I think is a very positive thing about just being a union member, and it's something that I wasn't aware of. I didn't realize how much empowerment would come with being able to be in a room full of people from all over the province in all kinds of different jobs and going, wow, we actually have the opportunity to make some changes. This isn't just one voice. We've got a lot of clout. We really do.